Lawmakers finding a new way to try to handle the emerging town halls on this issue by organizing a civil and bipartisan forum for conversation. Virginia Congressman Eric Cantor is the House Minority Whip. He's also going to be co-hosting one of these events. Congressman Cantor, welcome. Good to have you here today.
Good to be here.
So talk to me. What are you trying to do here with a civil discourse to kind of, bring the focus perhaps back to what matters from both sides?
Well, Martha, I think next week what I will be doing is meeting together with a colleague on the other side of the aisle, Representative Bobby Scott from Virginia. We both represent the greater Richmond area. And we'll be engaging in a very civil discussion about health care reform. Obviously, the two of us come from different perspectives, but I believe it's very much what the President came to Capitol Hill last week and wanted us to do, which was to set aside the partisan bickering and to try and get down to business and see where we can agree so we can move forward in terms of meaningful health care reform that doesn't necessarily mean replacing the government for the current system.
You know, we just listened to the president, and we heard him say that, the other side is trying to scare you. They're trying to tell you that you're going to be forced into a public option. He said nobody's going to be forced into this public option, which he, by the way, was still absolutely pushing for today at the AFL-CIO.
Well, listen, Martha, the notion that somehow we can have a government that competes when that government's also setting the rules is just counterintuitive to people. I think we understand that. We don't want that in this country.
We talk about the discourse and the level of discourse in this, and there's been a lot said recently, written on blogs and, even in the New York Times, that there's a racial element, that there's some sort of racial element to people who don't like this health care plan. What do you think about that?
Look, I think that this country has been and will be about public debate. We are premised on the notion of people being able to exercise their right to free speech. So we are going to have some disagreements. I think where we do all agree is that we all reject the status quo. We want to improve the system. We want to bring down costs so that more people can be covered and have access to quality care. So if we start from that point and then, first of all, guarantee we're not going to have a government takeover and that we don't break the bank in doing what we're trying to do, we can bring the American people to a point where they will realize a better system.
But I want to just go back to that, though. What's your reaction to the fact that, in some of these crowds there have been some signs that have been held up and they're getting a lot of attention, and some people are trying to group everybody who doesn't like health care into, and they're calling it racist. What do you think?
Well, Martha, obviously I reject that. And listen, people came to Washington last weekend on their own dime, on their own time. And that there is something to be said that if people are that passionate about what's going on, Congress ought to sort of reflect that notion and get down to work, which is exactly what we're trying to do next week with Bobby Scott in the forum that will be held by our local paper in Richmond.
All right, I want to switch gears for 1 second, Congressman, if I may, and ask you a little bit about ACORN, because I know you're involved in this issue as well. And earlier today, Leader Boehner came out, and he called on the president to cut all ties and to have the government cut all ties with ACORN. And now you've signed on to a letter that I just received a little while ago that I want to pull up a piece of, if I may, and it's asking the IRS to cut all ties with ACORN as well. And here's a piece of that letter from Representatives Boehner, Cantor, and Kemp. It says, despite these alleged abuses, which we have just outlined here in a previous story, the IRS helpline continues to refer individuals to ACORN offices for tax preparation consultation and continues to offer an implicit endorsement of their work. How do you think they're going to follow through on this? Do you think you'll get a response from the IRS on this?
Well, I sure hope so. And as you know, Representative Dave Camp is a ranking Republican member on the Ways and Means Committee on which I sit and has oversight authority on that committee and over the IRS. And I think most Americans are outraged that the federal government will be partnering with an organization that has committed some of the acts that we've seen on video on your network and others. So I'm hopeful that we can end the partnership with the federal government and that people are not routed when they call in to the government, routed to an ACORN office when you have this kind of conduct ensuing.
What do you think about these videos and about these young filmmakers and the fact that they've brought this issue to the fore after so many lawmakers and others have been trying to put pressure on this group for a long time?
Well, again, I think it is an instance where you have to say that our country is a democracy and that some, if not all, of the good ideas are going to come from the people. They don't come from Washington. So it is important, I think, that we value our rights to free speech and that we act when we see instances such as this where just absolute definitive violations of the law. And the federal government ought not have any part of that along with ACORN.
All right. A bunch of topics covered here, including health care, which we heard from the president on moments ago. Representative Cantor, thank you very much. Good to talk to you today.
Thank you, Martha.